My name is Jim Lark. I have the honor of serving as a professor at the University of Virginia, and it is my pleasure to be able to deliver an address to you today. It's entitled Warning, Governmentally Mandated Safety Measures May Be Hazardous to Your Health. Let's see if I can go down here. I'd like to thank David Clement, whom I've known for many years, for the invitation to speak here. I certainly appreciate also the tremendous hospitality that I've received. So, what I'm going to do today is give you a little bit of information about me. Perhaps after that you might actually figure, well, this is somebody I ought to listen to. I'll provide some examples of governmental efforts to reduce risk and the potential for perverse consequences. And then we're going to talk about the risk game show, one of my favorite examples, and then I'll be happy to take questions and comments. So let's see if I can use, yes, that's better. I didn't want to have to work for a living, so I became a university professor. I hang my shingle at the University of Virginia in 2 departments in the engineering school. I'm really a mathematician, but I'm in the engineering school. I also have affiliated faculty status in the Department of Statistics. I was a visiting scholar, visiting schmuck at the Center for the Study of Public Choice before it moved to George Mason, and I was an Earhart Foundation Fellow at the Center for Research and Government Policy at the University of Rochester. Great group of people there, by the way. I have the honor of serving on the Board of Advisors for Students for Liberty. I also have the honor of serving as the Secretary of the Board of Directors for Liberty International. I have a passing familiarity with the Libertarian Party. In 2000, they couldn't find any good candidates for chair, so they elected me. And then I served as the chair of the Board of Directors for the Advocates for Self-Government. The title of this lecture is a bit provocative. Sometimes it causes people to wonder about my sanity. In the teaching that I do at the University of Virginia, I teach students in many ways about risk and how to look at risk. And so what I'd like to do is present some examples that hopefully will help you to analyze issues of risk and regulation. And I will offer the suggestion that in some cases, government regulation, and I'll stipulate that the government regulation is enacted with the best of intentions, that the people who are trying to enact this regulation genuinely mean well, but in many ways their regulations may lead to more risk, to less safety rather than more safety. Some very important points that I hope you will consider is, it is difficult when you're dealing with complicated situations to evaluate how people will respond, issues of unanticipated consequences. If you seek to isolate one aspect of a very complicated set of interactions and you try to optimize with respect to that aspect, you may actually cause overall system degradation. Now, by the way, I suspect that this audience, this is not going to come as a shocking point, but for many people in engineering and in politics, this actually comes as quite a thunderbolt. The phrase better safe than sorry, it's a good idea. However, sometimes it's not clear what safe and sorry actually happen to be. And Aaron Wildowski's great line, no risk is the greatest risk of all, or the highest risk of all, I think is a very good one to keep in mind. So, one of my favorite examples, and I will admit I stole this from Gordon Tullock, who I think stole this from Sam Peltzman. Are you willing to stipulate that at any given speed X, if you're driving along, you're safer if you're wearing your seatbelt, your safety harness in the car? And I think that's reasonable. Now, by the way, leave aside peculiar cases of pregnant women wearing lap belts in the backseat of a car. All things being equal, typically you are safer if you're involved in an accident and you're wearing your seatbelt and safety harness, okay? So, given this, let's say we do stipulate this, would we see fewer traffic accidents, traffic fatal fatalities, if the government mandates that everybody wear a seatbelt, or perhaps involve primary enforcement of the law? Well, Lark's answer, and by the way, I'm like Forrest Gump, I'm not a smart man, but I like to think I do occasionally ask good questions, and I don't know what the answer is, but let's think about this. So, in my experience, and by the way, I love to drive. Driving is a passion of mine. People who feel safer and more secure behind the wheel of the car, perhaps by virtue of increased safety in terms of the way the car is designed, they feel more safe and secure, and they, on the margin, become more aggressive in their driving behavior. And I can see, because I drive high-performance automobiles, I can afford them, I'm a University of Virginia professor, and I know that when I started driving high-performance automobiles, when I got up to that long list of tractor-trailers, and I needed that little additional oomph to turn it up to 11, as they would say in Spinal Tap, and I could depress the accelerator, kick down, doggone it, that thing would go. So I noticed that my behavior began to be a little bit more aggressive behind the wheel of the car. Now, I didn't start running down little old ladies in crosswalks, but I know that because I felt safer and secure, because I knew the car would perform, that on the margin, my driving became a little bit more aggressive. I was willing to take a few more risks. By the way, of course, it was typically my life that was at risk. So let's say that that is true. Let's say that my seat of the pants, literally seat of the pants impression, is accurate, that people who feel safer and more secure behind the wheel of the car actually do, on the margin, become more aggressive driving, that they are willing to take more risks. Okay, if that is indeed the case, if we aggregate this effect over literally millions of drivers and billions of miles traveled, it's possible that now when accidents occur, they occur under more dangerous circumstances, that you actually have more fatalities rather than fewer. Now, I don't have enough data to be able to say what the answer is. But I can tell you, again, from personal experience, that I have seen people become more aggressive when they feel safer and more secure behind the wheel of the car. And one of the favorite thought experiments, and this is what I stole from Tulloch, who I think stole it from Sam Peltzman. Would we be safer? Would there be fewer fatalities if instead of the government mandating an airbag in the driver steering the column, it mandated a sharp steel spike? And the faster you go, the closer the spike gets to your heart. Now, the point, excuse the phrase, the point of this is that this would make very clear, very explicit, the trade-offs in driving faster. And I will state very clearly, I think if the government mandated a sharp steel spike in the driver's steering column, we'd have fewer fatalities. Now, I'm not saying that's a good thing necessarily if you take it all into account, but I think we would have fewer fatalities. And it should also be noted, this is something, by the way, that used to be a pretty hot topic in political discussion. Airbag deployment has actually killed young children. A note, when you see airbags deploying on the news, they always are in slow motion. You see this nice, pillowy, soft, like a nice, soft, comfy pillow coming at you and cuddling your face. Well, no, a more likely, a more accurate description is you got hit by a pillow that was shot out of a shotgun, because it has to deploy very rapidly. And so whenever you are trying to mandate safety technology, you have to consider that there are many implications, and some of them, it may be that, yes, overall, airbag technology, and I do think it's safer. I want to have airbags in my car. But you have to realize that maybe the way people will actually drive, the way people will actually behave, there may actually be increased risk, perhaps for a subpopulation that is worthy of consideration. By the way, with click it or ticket laws, people talk about, well, since click it or ticket, we've actually had fewer fatalities. But one of the classic examples of failure to do statistics properly is to say, well, was there a trend line down? I mean, were traffic fatalities already going down? So you actually have to think about these things. And again, the point that I make here is, what are the long terms of traffic fatalities in cases of recession? Fewer people are driving. You have less activity on the highways. So you have to be very careful to do proper analysis. And by the way, proper data analysis is hard. It requires a lot of thinking. And sometimes you don't realize what the most important variables are until you actually get involved. Sometimes you don't realize what important variables were left out until long after you've done your analysis. One of my favorite examples that I use at the University of Virginia, let's say that we come up with a way of measuring the safety of large passenger airliners. Okay, an Airbus 380, a Boeing 747, the queen of the skies. Let's say that we come up with a way of measuring safety, and we measure that safety by a number, a scalar. Now, you can measure safety with respect to various attributes, in which case you would have what we would call a vector. Well, it's kind of hard to compare vectors. Let's say that we can reduce safety to a number. And let's also assume that bigger is better. The bigger the number, the better, the safer the airplane is. All right? Let's say also that you, being the brilliant aerospace engineer, you've come up with a device that you can put into an airplane, and it will increase the safety by a full order of magnitude, factor of 10. And let's say that you can also retrofit this onto older airplanes so that they can get the safety benefits as well. The FAA finds out about this and decides, by gum, all airplanes should have. So we're going to mandate that every airplane, new airplanes as well as old airplanes that can be retrofitted, they're going to have this wonderful device. And incidentally, we'll also assume that there's no argument that this is actually a genuine step forward in safety. Sometimes that's not completely clear. Let's assume that everybody agrees, yes, you are increasing the safety of the airplane. Right. So if airline firms were forced to incorporate this technology, this device, would there be fewer fatalities? And again, Jim Lark's not a smart man. I don't know. But let's think about this. Let's give this a real good think. All right. You have to clarify the question. Fewer fatalities. Are we talking about fatalities overall? Are we talking about fatalities with respect to airline? By the way, one of the hardest things to do in many cases when you're listening to questions about public policy and data is to make sure that everybody's talking about the same thing. Because there's a natural tendency to assume that we're all talking about the same thing, and it turns out that's not true. By the way, really smart people, in many ways, are the worst at making these interpretations. Really smart people sometimes, precisely because there's a lot going on, they don't necessarily bring focus to the issues. Again, Forrest Gump, look at that ping pong ball. The thing you do is always keep your eye on the ball. Given the assumptions of the problem, I personally think that mandating the challenge probably would reduce the number of air fatalities. By the way, they're very low anyway. It is very unusual for big airplanes now to crash. It does occasionally happen. In fact, there was a decision recently about the Airbus crash, the flight from Brazil to France, but it is really unusual for that to happen. So again, without more information, we really can't determine exactly what's going to happen here. We need to know the cost of the mandate if we want to try to determine, is this going to lead to fewer fatalities? Let's say that the mandate forces, because of the mandate, the increased cost of building planes or retrofitting, it jacks up the cost of the ticket. Maybe jacks it up significantly. Well, perhaps then people will shift from flying to driving. I know I go down to Jacksonville, Florida every year because I've got a good friend who has season tickets to the Jaguars, and I am something of a masochist, so I go down every year. Well, if the cost of flying is significantly greater than the cost of driving, I may sometimes drive to Jacksonville as opposed to fly there. Well, if driving an automobile is essentially a more dangerous mode of conveyance, then by virtue of people shifting from a safer mode to a less safe mode, you may actually have more fatalities. Now, can we say with any sort of great degree of accuracy what's going to happen? The answer is no. What I'm pushing for, actually, and I'll sort of jump to the end of the joke here, I'm pushing for people to have a certain degree of modesty. In my opinion, humility and modesty are always in fashion in both matters of engineering and public policy. One of my favorite whipping boys is the FDA. Some of you perhaps share my enthusiasm for whipping the FDA. The FDA has police powers to basically to regulate what you do in terms of putting stuff in your body or having things applied to you for your health, safety, or comfort. Let's first ask a question, because they are charged with the responsibility of trying to keep our drugs safe. What's a safe drug? Does anyone have a good definition of a safe drug? I'm not sure that there is a well-accepted definition of what a safe drug is. And even if we have a definition of safe drug, it's possible that that safe drug is not going to be particularly efficacious in terms of helping us deal with matters of disease. So we have to ask many of these questions. The FDA frequently, in their effort to promote safety, and again, I do not question the motives of those who basically embrace a much larger role for government involvement in our lives than I would. I don't question their desire to help. But in many cases, they may actually cause more harm because they kept substances off the market that could have been very helpful. And by the way, notice that the government is engaging in a pretty hideous form of discrimination. We're going to protect you, other people are going to be hurt. That raises some very important moral questions. And by the way, how do you trade these things off? The next slide is one of my favorites. I got this from the Wall Street Journal many years ago. A woman who had a very nasty form of cancer, and I'll just read it. The government wants proof of efficacy before it will allow me to take this drug, ET-743, outside of an approved trial. But the, quote, proof, unquote, is years away and I need the drug now. It's safe. It might work. Johnson & Johnson would let me have it if they could do so without the threat of government hassle. But they're so caught up in the FDA web that the life of an individual patient has no importance whatsoever. Without ET-743, I'm a dead woman walking. 5 kids are going to wonder why they're left without a mother. Won't somebody help me get this drug? A woman named Edie Bacon, writing in the Wall Street Journal, November 29, 2002, nearly 20 years ago. Eventually, the FDA did get around to approving this for this particularly horrible type of cancer. How many people were hurt, died, because they could not get a substance they were willing to try, that the purveyors were willing to offer, fully disclosed risks? By the way, I will point a personal point. I don't think the fires of hell burn any hotter than for people who would stand in the way of having sick people to be able to get the treatment that they want and they're willing to take. So, anyway, personal comment. If the FDA were to relinquish its police powers, which I think it should do very, very quickly, the costs of the regulatory process are extremely great. The cost of actually getting a drug approved can be staggeringly large. And in fact, in many cases, companies won't even start because it's so, the technical term is so damned expensive to actually get a drug through FDA approval process. And I note here, of course, this is the additional expense capitalized into the cost. That drug costs a lot because the companies have to recoup their costs. You also have the delay. We have seen, by the way, some improvements with respect to government regulation in this area, but it largely came, incidentally, because politically active people who were really loud and in some cases proud basically campaigned for changes in the law so that we could have the right to try, at least in certain situations. And of course, this is one of my favorite. If those of us who are getting old, sometimes when we try to take the childproof caps off, we have to basically get a chainsaw to cut the damn thing off. I'm not saying that this is a major cause of problems, but elderly people, and I'm not there yet, but I'm hopefully heading that direction, sometimes getting those blasted childproof caps off is hard for elderly people. Another little example, and this is one that I don't think people take as seriously as they should. I watch a lot of sports on TV, and a lot of advertisements on sports are for healthcare products for old guys like me. And they'll say, come and take this product, it'll make you healthy. And then they have this long list of things, of potential maladies that you might, usually the guy is reading at an incredibly fast pace about all these potential maladies that you're going to have. I get scared to death. I don't know that I want to take this stuff because of all the potential maladies. I have no way of comparing the risks. So the very good principle of informing people about what the risks are, sometimes you may actually deter people from choosing things if you don't give them enough information. So it's possible that people will, I don't know that I want to take this medication because I have no real way of looking at what's going on in terms of the risks. And there are many, many more examples where regulation may have deleterious consequences. And I put this last point, it's been, we're looking at 60 years since Rachel Carson's Silent Spring was published, which basically led to bans of DDT. How many people in very poor parts of the world ended up suffering by virtue or dying by virtue of dread diseases because you couldn't use DDT? By the way, Dan Fishman, my friend Dan Fishman, mentioned that when I gave this talk at another location several years ago, so I thought I'd toss that in. As I noted previously, in some cases it is really it's difficult to determine how people will actually behave when they're faced with these various regulations. If you try to isolate one aspect of a very complicated set of interactions, you may cause problems, overall system degradation. Better safe than sorry. I agree with that, but it's a good idea to know what safe and sorry happen to be, and I think no risk is indeed the highest risk of all. And so I want to emphasize this point. I mentioned it previously. Whenever we deal with discussion of this, I think it's important for us to assume good motives on the part of other people. Don't assume bad motives unless there's darn good evidence there. I think that the people who argue in favor of a, shall we say, a robust ability of the FDA to regulate what you put in your body for your health, safety, or comfort, I don't think they mean ill. In fact, I think they mean well. But good intentions are not enough. And so, A couple of points, I always offer these in terms of discussion of this. In a free society, the default value should always be freedom. The burden of proof should not be upon us. Those of us advocating a truly liberal society, a society of individual liberty and personal responsibility, we should never have the burden of proof. The burden of proof should always be upon the shoulders of those who would use the coercive mechanism of the state to impose upon us. And I think we need to say, look, the burden of proof is not on me. It lies upon your shoulders, not upon mine. And also, this point I made about discrimination. When government regulates for the business of safety, they may be engaging in a pretty hideous form of discrimination. We're going to protect you at the possible cost of the lives of others. Do we really want to give government that power? I think the answer is no. And then the risk game. Let me see. We've got a little time. I'll just. You're invited to go on the TV show, The Game of Risk. What will happen is there's a randomizing device that will flash either green or red. And you receive a prize, depending upon whether you get a green light or a red light. Green light flashes, you win $1 million. That's still a lot of money where I come from. Red light flashes, oh, Maynard, horrible death. P, the probability that you're going to get a green light is strictly less than 1. You get to set, oh bloody hell, you get to set P. You can make P as close to 1. You can make it 0.9, 0.99, 0.999, 0.99, but you have to truncate. You cannot have certainty that you will win the $1 million. There has to be a residual uncertainty. You will die a horrible death. How many of you would play the game? I knew okay. Well, the game show's been on for a while. You know, the thrill of seeing people die really, really horribly is starting to wear off. So the sponsors are starting to get a little hinky about this. And so if indeed what we do, if we change the reward from $1 million to 1, now how many of you would play the game? I knew it. I suggest that we play this game every day of our lives. Did you cross a street to come over and hear my incredibly interesting, not to be missed, hopefully to be made into a movie talk? Is that a riskless activity? Not in Miami. Hell no. The University of Virginia, did you come to come hear my lecture? Did you cross the street? Very dangerous activity in Charlottesville, Virginia. I like this example, and by the way, my students almost always remember this example because it frames an important issue, in my opinion, the right way. We make decisions all the time that have non-zero, admittedly small, but non-zero risk of catastrophe, either for ourselves or for others. Tom Sowell has a wonderful line. He says, in most human affairs, we don't have solutions, we have trade-offs. We make trade-offs every day.